Have you thought about how to increase your physical activity? Try Triton cycling, an intervention for UCSD students. In the United States, heart disease is the leading cause of death amongst the entire population. According to the CDC, every 33 seconds, an individual dies as a result of cardiovascular disease. Though this outcome can be in relation to genetics, it is highly influenced by unhealthy lifestyle choices regarding nutritional and physical activity habits. Some risk factors are high blood pressure, high cholesterol, unbalanced diet, and lack of exercise. Significance. Over the years, the college student population has shown a decline in physical activity levels, impacting their risk for heart disease. According to the World Health Organization, 150 minutes to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity is recommended on a weekly basis. On average, 46.3% of adults do not meet either criteria, as shown in the graph below. Furthermore, physical activity is an essential part of maintaining a healthy lifestyle. Studies have shown that following the recommended physical activity guidelines have been linked to a 17% decreased risk of CVD. Cycling activity is considered a moderate intensity. A minimum of 150 minutes is recommended to fit the WHO guidelines. Cycling is a beginner-friendly exercise for those starting their fitness journeys. Stationary bikes reduce the risk of safety hazards, cost-free as they are provided by UCSD, and educational since an instructor will be guiding the workout classes.
So these are two previous intervention research studies that are related to our own study. The first one is feasibility of smartphone application and social media-based intervention on college students' health outcomes. This tested a 10-week program using a fitness app and social media to help college students improve their health behaviors. The pros included high participant retention rates, use of both smartphone app and social media, which cater to the digital lifestyle of college students. The limitations were that it only included 44 college students, lasted for only 10 weeks, and the fitness app didn't offer significant benefits beyond the social media intervention. The second study is testing a social network intervention using vlogs to promote physical activity among adolescents. This compared the effectiveness of a social network intervention, mass media intervention, and no intervention in promoting physical activity among adolescents. The pros included a randomized control trial design, which enhanced the reliability, and then objective measures such as wrist-worn accelerometers provided reliable data. The limitations were that the use of vlogs as the main intervention tool might not have been as engaging or persuasive enough for all participants, and the reliance of self-report questionnaires for measuring the social norms and responses to vlogs might have introduced bias and affected the accuracy of the results.
Our target group are any UCSD students living on campus that can have direct access to our intervention offerings. This is because we know students lack resource accessibility, and through our intervention and delivery method, we hope to bridge this gap regarding physical activity. When it comes to our intervention plan, we have two components. First is the community level intervention, which includes implementation of a wellness center for students to change the built environment at UC San Diego. This would include free cycling courses and competitions with an assigned wellness coach. Additionally, to maintain long-term physical activity, we will also have a recovery center to prevent injury, which includes stretches and ice baths. At an individual level, we are also going to implement social media updates to check on cycling progress. This would include maintaining attendance, updating others on cycling progress, and incentivizing physical activity through competition. On this slide, we have also included examples of social media uploading options that students may have to share their progress. This brings us to our main question: how will this promote behavior change? There's three components to this, the first being competitive instinct. Young college students can have their competitive mindset to serve as motivation to increase physical activity. The second being efficient resources, with accessibility to coaching and recovery practice in the Wellness Center. Students will be able to stay fit and healthy to continue cycling long term. For the third slide, there's also the changed environment. With more accessibility with the Wellness Center resources, students will not struggle finding a safe place to cycle. To ensure that our intervention is efficient and successful, our follow-up intervention may include students measuring progress through heart rate monitoring, feedback from Wellness Center coaches, point progress on student-wide program competitions for the cycling program, and also checking social media pages for progress updated amongst UCSD community members.
For our interventions evaluation plan, our process evaluation is the effectiveness of social media in promoting our cycling session and how many students become aware of them. Our expected outcome is to increase physical activity and lifestyle changes, and our expected impact is to enhance students' psychological state and to reduce future cases of heart disease. An individual component of Triton cycling will be an attendance sheet to track the frequency of our participants' commitment. Another measuring component will be a bicycle monitoring device to gather data of our participants' activity in the cycling session. The use of heart rate monitors will help us identify rate differences throughout the intervention based on their engagement with them. For our community factor, we hope to change the built environment by building a new wellness center to expand resources, increase access, and exposure to physical activity. Having space for more bikes will not only increase access, but our number of participants. One of those will be through Instagram, where we will offer peer support. Another one is face-to-face, where our cycling instructors will be leading these daily sessions.
This physical activity calendar shows the days that the classes will be available. Each class will be 30 minutes. As for cost and resources, we will be partnering with the UCSD Rec Center for the allocation of stationary bikes. Funding from the American Heart Association will allow us to practice medical research by purchasing the Apple Watches for our UCSD student participants to measure their heart rate and for us to evaluate them for future outcomes. Also, funding from UCSD will allow us to expand bike access by building a new wellness center where we will be able to have more cycling rooms as well as pay for cycling instructors.